I became interested in journalists in 1999 when I had a patient referred to my clinic. And she turned out to be a war reporter who had developed some significant psychological difficulties while covering a famine in East Africa. And she was a really interesting patient. She did well with therapy. And I remember saying to her at the time, you know, you could see yourself getting into difficulties while you were out in the field. Why had you not reached out for help earlier? And she said to me, well, you don't understand my profession, that if you let on that you're having some emotional difficulties, they will not send you out to do this work again. And I love doing this work, and I didn't want to compromise my career. So I found that a really interesting observation. I am, by day, a mental health researcher in the field of multiple sclerosis. I don't research journalists. I run an MS lab at Sunnybrook. And I remember saying to my research team, you know, just take a couple hours off from your work and go and do a literature search and tell me what's been published on journalists, war, conflict, and psychological difficulties. And they came back and said they couldn't find a single publication, not one, which was very unusual because the world of psychological trauma has a huge literature, whether it's veterans or policemen or firefighters or victims of assault or sexual assault. There is an enormous trauma literature, but there wasn't anything on journalists. So the year was 1999. It was pre-9/11. The world was a much easier place then, if you remember. And I wrote a grant application and sent it to a group in Washington, D.C. called the Freedom Forum, saying that I'd like to do a study looking at war journalists and how they deal with the psychological stress of war. And to be honest, it was the easiest grant that I ever got. They wrote back and said, yes, this is a really interesting question. Here's your money. Go and do the study. And so we did a study looking at a very large group of war journalists who had covered conflict predominantly in the Balkans, because the civil wars had just been coming to a close in the Balkans, and many journalists had spent a long time doing that. From there, I moved on to doing a second study, because soon after that, 9/11 took place, and news organizations in New York said, we're worried about journalists. Could you come down to New York and have a look at the mental health in some of our journalists? So we did that. And then the war in Iraq started in 2003. And so we went to look at journalists covering the war in Iraq. And after that, questions arose about, well, what's going on in Mexico with the drug violence and how are journalists affected there? And UNESCO sponsored that study. From there, we did a study looking at journalists covering the civil war in Syria. We went to have a look at journalists looking at how had they responded to the election violence in Kenya. And more recently, we've looked at journalists in Iran and how did they. And I raise all these various studies because across all of these studies, there's a consistent finding, which is that journalists are for the most part resilient, but resilience doesn't give you immunity to mental health difficulties. And we do find evidence of prominent post-traumatic stress disorder in journalists who've been exposed to life-threatening events or who've witnessed other people getting killed. And the rates of PTSD relative to the general population are not insignificant. So when you look at a group of journalists who've done frontline work, on average for about 2 decades, there's an cumulative effect of this exposure to trauma. And you see rates of PTSD that are very close to what you would see in combat veterans. But it's more than just post-traumatic stress disorder. You also see high rates of depression, significantly higher than in the general population. Plus, there's a triad over here. The third piece to it is substance abuse. Because within the mental health literature, when people are emotionally distressed, they tend to use alcohol to self-medicate. And so, you know, journalists might be using alcohol as a hypnotic to fall asleep or to dampen down their anxiety or just to kind of take away their overall levels of psychological distress. And so we've kind of replicated this finding across countries, across societies, across cultures. You see the same kind of profile emerge. The study that I want to speak about today is somewhat different, although it overlaps. I was asked to do a study looking at journalists who don't go to war zones, but whose job it is to sit in a room and look at images of violence that are sent to the newsrooms, often from the man in the street. So, for example, if there's a suicide bombing in Syria, for example, someone pulls out a cell phone, they take some pictures, they take some video. What do they do with it? They send it to the CBC or to the BBC or to CNN, etc. And news organizations now, as you know, have individuals whose job it is to screen all this material. And the question that was asked of my research group was a very straightforward one. You know, what's the effect of all this visual material on the psychological well-being of the journalists? So we started to do the study. And two large news organizations took part. One was American and one was British. And they opened up their roster of journalists to us and see these are the individuals who are looking at user-generated content. And the majority of journalists actually wanted to do the study. They were keen to tell us how they were feeling about their work. The first observation is that there's a broad range of exposure to this kind of material. So some journalists might have half an hour viewing once a week. The other extreme, there are individuals who are looking at this for 5 or 6 hours a day. That's all they do. They come in and for prolonged periods screen all the material. Now, of course, not all this material is violent, but a great proportion of it is. And they're exposed at times to some images of terrible violence, particularly with ISIS and some of this material that makes its way onto the internet. So we had a look at their emotional responses, and we looked at, once again, discrete conditions like post-traumatic stress disorder, depression, substance abuse, and anxiety. And once again, you see that the majority of journalists are resilient, but there's going to be this subgroup who start developing symptoms. I should state that the level of symptomatology is quite a bit lower than what you would see in a journalist who directly goes into a war zone. But it doesn't negate the fact that for some journalists, looking at this material is deeply distressing. And you start seeing a syndrome develop. It's almost like a PTSD by proxy. They're not there themselves, but this relentless exposure to beheadings and torture, etc., certainly is very difficult for some people. And then you start seeing the cardinal PTSD features arise, such as the re-experiencing of the trauma, that they go home in the evening, but they can't shut off memories of what they heard or images of what they saw. And some of it starts intruding into their dreams. And then, the natural reaction to that is, well, they want to avoid this. You don't want to go back and have a look at it. But their job says this is what you've got to look at. And so the next day they're coming to work and their physiology, as you see in PTSD, is saying, avoid this, don't go there, try and push it away. But the nature of their work demands that they have to look at it again. And then you see the third triad of PTSD symptoms arising, which is your body's autonomic nervous system becoming hyper-aroused. So you start becoming a little anxious, and you have difficulty falling asleep, and you might not be able to concentrate. And those features can be very disturbing as well. And so you do see the PTSD syndrome emerge in a subset of these journalists. And then comorbid with that, some of the journalists start becoming depressed as well. So you're not just talking now about feeling sad for a couple hours or so, but this is a pervasive sense of sadness, which by definition is there for more than 2 weeks, accompanied by difficulties with sleep and appetite and energy and self-esteem, etc. And then the third piece of the triad is there. Some journalists start using alcohol as a way of self-mitigating their distress. Can't get to sleep at night, I have a drink. Still can't sleep, I have another drink. When I go out, I feel socially anxious, I'll have a few more drinks just to kind of calm me down. And alcohol is a very bad hypnotic, it's a very bad drug that you want to use to self-medicate yourself. So we saw these difficulties arising in some of these journalists whose job it is to look at this material. The final point that I want to make is, well, what are the risk factors? Is it duration of exposure to it? Is it frequency of exposure? How can you work out which individuals might be at risk? Well, number one, if journalists come to this work with a previous mental health problem, they already have a vulnerability. So you see this. If someone had in their past developed an anxiety disorder or depression, then they are more vulnerable to developing distress in relation to this work. And in fact, this is a given across multiple stressful situations. So that's not unusual. But then we had a look at frequency of exposure and duration of exposure. And it was really quite interesting. The journalists who are doing this for 6 hours a day did not endorse a whole lot of symptomatology. And our interpretation of that was, in a sense, they start habituating to it. If you're doing this day in and day out, one way that they try to cope with this was just to push it away. They were quite effective in blotting out some of it. But the journalists who were getting exposed to this in short, sharp bursts, frequently, repetitively, were the ones who endorsed a lot more symptoms. So if they were doing it for maybe an hour a day, 30 minutes a day, missed a day, came back the next day, half an hour, 45 minutes, missed a couple of days, etc., that was a group that had great difficulty, it seemed, to be processing what they'd seen and dealing with it psychologically. Usually in situations like this, you look for some demographic clues as well. You look to see whether women are more vulnerable than men, and we found this over here. Women were more likely to develop some of these symptoms, but certainly the men were not immune to it as well. The higher your level of education is protective as well, but once again, doesn't give you immunity. So we could tease out some clues as to individuals who might be at risk with respect to developing these symptoms. My final point before I hand it over to my colleagues is that this is just one study. It's always good to go back and replicate these results and to see whether this is in fact the correct interpretation. But the sample size was big, and certainly the statistics were quite strong. So I think there's going to be some validity to what we were able to determine.